Welcome, everyone. My name is Yoonjung Park. I'm the program director of the Africa China Initiative at Georgetown University, and we're so pleased to have you here at our monthly webinar. Today, we're featuring a new report that is about to be launched. The final version is actually not even available publicly yet. Um, it's on aid or investment. What is at stake? Learning from China when global health is at a crossroads. The main author of this report is Professor Jennifer Bowie, who has a joint appointment at Georgetown as well as at Rand. But before we introduce Jennifer, I want to introduce everyone to my newest colleague in African Studies, Professor Dr. Bulelani Gilly. Um, Dr. Gilly just joined us this semester, and he arrived from Boston, Harvard University. He is our newest assistant professor, um, and he's part of our African Studies program and an affiliate at the Science, Technology, and International Affairs program. He's also a faculty associate at the Berkman Klein Center for Internet and Security at Harvard Law School. His primary areas of research include Africa-China relations, cybersecurity, ICT development, African political economy, internet policy, Chinese business law, law and development, and privacy law. With that, let me hand over to Bulelani, and he will introduce both of our speakers for today and serve as moderator for the rest of the event. Thank you again for joining us. Thank you so much to the Henry Luce Foundation for supporting our work. And thank you to our host body at Georgetown African Studies program. And a shout out to Brennan Young, our program assistant, without whom none of this could be possible. Okay, over to you, Bulelani. Thank you.
Oh, hey, thank you so much for the warm introduction. And principally, as my role today is just to, at first, just offer some basic introductions. And so, with that said, I would like to first introduce Professor Bowie. She is the professor and chair of the Department of Global Health at Georgetown University's School of Health. And she's also an affiliated professor in the STEA program, the Science, Technology, and International Affairs program at SFS, so at the School of Foreign Service. She's also serves as the Tang Chair of the China Policy and Studies at the RAND Corporation, where she helps lead the interdisciplinary research on issues like global health, gender equity, and and also technology and governance in Asia. And she also has done several testimonies on Capitol Hill on this kind of issue on global health and COVID-19. I would then also like to introduce Professor Huang, and he is a senior fellow for global health at the Council on Foreign Relations, where he directs the Global Health and Governance Roundtable series. He also is a professor and director of global health and studies at Sinton Hall University's School of Diplomacy and International Relations, where he has developed the first academic concentration among the US professionals in the International Affairs School that explicitly addresses questions surrounding security and foreign policy aspects of health issues. And he's a founding editor of the Global Health Governance, the school journal for the New Health Security Paradigm Program. And with that said, I'll let them begin the conversation.
Okay, I will start with a presentation. Good morning, everyone. I feel that I'm with all my favorite people here on the panel. I worked with each of you, and I really appreciate the audience to spend this beautiful Friday morning in DC, but many people probably also from the Friday evening in Europe and Africa. And this is my favorite platform, just to say, Yung, because I always hear authentic dialogues here. Thank you for keeping this up and your work. Let me try to share my slide. Right. Can you see the presentation mode of the slides? If you give me a sum up, I will continue.
Can you just switch views, please?
Okay. Does it work now? Okay.
Perfect.
Perfect. Great. So I'm here today to talk about China's global health activities in Africa. And as Yong mentioned, this will be soon published as a RAND report, and it will be provided for free on RAND website. And here I do want to officially thank the organizer, the Africa-China Initiative of Georgetown University, as well as the Georgetown U.S.-China Dialogue programs. This report is sponsored by the RAND Research, China Research Center, as well as the Town Chair Endowment that provided by the Cyrus Town Foundation. The report has passed the quality assurance. It's a very long process at RAND Corporation. But many of the opinions that I talk about today is my own opinion. It's not representing either Georgetown or RAND. And RAND Corporation, if anyone don't know, it's a nonprofit think tank in the United States. It's non-partisan, and it's really strive to provide evidence-based research for policymakers for the U.S. as well as for policymakers around the world. I would like to also to thank my research team. This report is not a one person's work. We conduct 2 years of work on a comprehensive desk review, as well as a in-depth research in the field in Africa, and I'll talk more about. So I want to highlight the 2 graduate students at the time, Agnes Wang and Rakesh Penzi from RAND Graduate School. I also want to highlight my co-author's work, Carrie Dolan, who is an associate professor at William Mary, and she's a spatial epidemiologist, and she has published high-impact articles using a database to look at China's global health activities in many parts of the world. And her work on the malaria, the China's global health in the malaria, is also a high impact journal on the journals. And last but not least, Oliver Johnson. I had the honor to work with him at Georgetown before he left, now back in London. And he published a book of Getting to Zero, really document vividly a physician's journey during the Ebola epidemic in Sierra Leone. Highly recommended his book, and his knowledge in Sierra Leone in this health system and pandemic response really helped me and helped our team in this research. I would also like to thanks to many of the stakeholders that we interviewed in Kenya and Sierra Leone. They managed to talk to us candidly when we visiting these countries and provided us their knowledge on China's health care. And of course, I thanks to the donors and the support from RAND. And these are the people that we talked to in Kenya and Sierra Leone. As you can see, they range from the urban hospitals to rural clinics, from academia to international organizations to community, the civil society. And we even talked to some of the China medical teams during the trip. And I really appreciate their openness with our work. So today, and of course, I want to thank our discussant, Professor Huang. Your work, especially the comprehensive review of China's policy on global health, has always been my reliable resources, and I'm looking forward to have this dialogue with you. So I want to talk about what is this report is about and a little bit more on the rationale of the research. Um, for 30 minutes, which will fly by, I think very quickly, I will probably not go to the technical details of and the numbers of the report. These will be there for everyone's consumption once it's live. But today I really want to talk about why we're doing this type of research and why it's important for policy and what we have read, what we have heard, and what we have saw on the ground that can provide some, hopefully, some evidence for the policies. So to start off, why we're doing this global health, we're looking at China's global health impact. I want to talk about my early exposure to global health aid. And that goes back to 20 years ago when I was a public health researcher and getting NIH funding and working with the high-risk groups of HIV in China. At the time, the world just got to know two silent epidemic outbreaks in China on HIV. One was discovered by accident by hepatitis B surveillance. The other one was due to the contaminated blood samples has been at the time been covered by the local officials for a long time. So at the time, the world was panicking because if we don't know what's going on in China on HIV, will there be a much larger epidemic? And this is right after the SARS, when the weakness of the surveillance system, the disease surveillance system, was exposed. And at the time, Chinese government was very cooperative and open to international partners to rebuild its CDC, its disease surveillance network. And by working in China for about 10 years during the time, I really witnessed how US agencies helped China to build its not just the national reference labs, provide the funding so that empower the public health agencies and sectors to be on the decision making and the discussions at the national level. They also help build the country's guidelines for HIV care and provide the teaching of how to treat HIV patients, and also brought in the medicine and so on. So to me, it's a 360-degree type of support to rebuild China's public health responding to HIV. And through this process, I also see what they brought to China is not just the technology and funding, but it's also new concepts. And those concepts, such as harm reduction, that you're not just locking people up when they're having high-risk behaviors, but rather treat the disease and care for the people. And that really changed the relationship of public health in that society. And it was the first time, one of the first times, that China actually supported the grassroots peer education group. Those are non-government NGOs. And within a few years, almost 1,000 NGOs showed up organized with this effort of HIV response. And I would also like to say, after 20 years of this experience, the government know that they have to rely on the community for disease prevention and treatment. And they kept the funding for these organizations even till this day, even after the Global Fund left, after the US CDC left. So that's really my reference to what is global health aid. And I summarize some of these findings, and including the systematic support system in the U.S. global health work in Asia, as well as HIV response in a CSIS and Brookings report. Although if I have the foresight, I probably will name the report of the past, not the future, but that's a different issue. So when it comes to China's global health aid, it certainly came into the spotlight just in the last 10 years, even though China's aid has been visible in Africa for a long time. So 2017, with Tsinghua University, I published this, the first time to use the aid data, and I've seen that data set have grown over time. And with the two testimony on the Hill talking about U.S.-China work on global health and in the context of COVID-19, that's another time I look into the data on the China's global health aid. And recently, working with aid data in William Mary, we create this rent-free platform to show a web tool to show the projects for each country. And these are, I can provide a link for these. But as I was working on this project, I realized there are three barriers, at least. The first one, of course, is data. That all that we have seen from the two white papers from the China's foreign aid official white paper, the data are very limited. One of the recent ones, it's not 2024, it's actually 2014. It's very high level. They talked about the source of funding for these projects, and only for 2 years, for 2010 to 2012, and which they shows that more than half of the projects were based on concession loans. This would be very misleading if we see this is the picture for global health aid from China. As I will show you later, from the data that we analyze, there are only about 3% of the aid data, health aid data, is coming from loans. Most of the projects are actually grants or technical support. But when the data are not there, there's a question of, are they providing aid, or are they really just seeing this as an investment? So aid data, in a way, helped us. At least we can look into the sectors of the projects. We can look into what are the projects that are targeting health, and that's the one way. Certainly not perfect. There are lots of problems and limitations that I mentioned in the report. But that's one issue. And often people ask, okay, what is the impact of the aid? And so far, I have to say, there's really no quantitative good evidence of the impact of these aid yet. And the second dilemma is that, as Professor Huang and I know, Professor Huang is from the political science background, that this global health aid has reached to many different sectors. But usually in the think tanks and especially academia, we usually publish only in our own journals. So that's causing these silos that even though we're working on the same topic, often we're separated by the disciplinary silos. And we usually don't want to getting into the dangerous zone that how can a public health specialist talking about foreign policy or soft power, right? So we risk using the wrong terms or using the wrong concepts, but this need to be done because policymakers have to look at all these different areas, and we need to support that. And the last dilemma I will talk about is what usually both in Chinese literature and English literature, we don't see a lot of African voices. We don't hear about them. So that has been documented in many research. So those are the dilemmas. So why now? Why we talk about China's global health now? We certainly see that during COVID, several things happened, right? Post-COVID. One is China's global health aid become more visible. Whether your opinion about it, it's definitely more visible in the media and to the public. And secondly, the COVID-19 caused a reflection on many African countries to think about their reliance on aid and why it's not available during a pandemic. And the third part is that US and many Western global health donors have changed post COVID-19. And as we know that in the US, it is a time that many of the global health leaders are thinking about how to rebuild its global health aid. What is the philosophy behind that? And what would be the implementation process? And for China, we also see, I'll talk about the global development initiatives along with the 4 other initiatives, along with BRI, and how would that change China's aid model in the future? So those are the things that really make this time a good time to start to talk about, to understand what is China's global aid, health aid. So for this report, we're trying to target 4 questions. First of all, what is China's health aid? How can we separate it from aid, from investment, from different motivations, right? So we want to see what drives them. Because without knowing them, we are always puzzled by what we see on the ground. And secondly, we want to understand how African stakeholders perceive this aid. We want to hear the African voices. And third, as I said, we want to know what motivates. And this is where, I tapped into both foreign policy as well as China's economic focus, development focus. And then, of course, at the end, as a RAND report, is always want to provide some of the evidence-based implications for policymakers. And here we provided a few for the US and recipient countries. In terms of policy methodology, we used a historical review. We also did country case studies, interviews in the country. We also rely quite a lot on a data that we converted to a web tool at RAND. And lots of the statistics you see were coming from the over 2,000 health projects. That's between year 2000 and 2021. That includes 600 China medical team projects. And specifically for the 2 countries, we see 29 projects in Kenya and 36 in Sierra Leone. And in the field, when we talk to the stakeholders, we ask about their view, what they see as a China global health aid projects, how this is different from other donors' projects, and what are the advantage and disadvantage for China's projects. And we also ask about the policy recommendations. And when we're in the field, we're trying also to verify data's projects, the accuracy of these descriptions. So I have 5 findings. The first one is as we're looking into the history of China's global health aid programs, many people only notice of it recently during COVID-19, but we all should know that the first China medical team was sent to Algeria in 1963, right after the colonial war and anti-colonial war. And when the French doctors left the country and there was a void in their health system. So that was the first Chinese medical professionals going to a country to provide health care. So I divided the past 40 years, more than 40, 60 years, into three phases. The first phase, of course, is from 1963 to 1978. During the time is China's global health aid is following Maoist, I would say, health diplomacy for solidarity. This is when China sending the medical team to countries, even though China's GDP is lower than many of these countries, as Professor Huang's report showed. And when during the Great Famine, when 30 million people died in China, rural areas, China still providing food to Africa. So this is really supported by this political fever of seeking solidarity with at the time called the third world countries. And that China benefit from these efforts. China joined the WHO in 1971, and then soon becomes part of the global health community. But that changed in 1979. So this is after Mao era, and when Deng Xiaoping came back to the power in China. And in this period, I would say the last 40 years, so this is from 1979 to 2020, China really focused on its own economic development. So when CCP put that as the focus of the country, you see that everything changes, including the health aid. First, three stages in this 40 years. I would say that the policy pretty much changed every 10 years, every decade. Why 10 years? Because there's always a 5-year planning stage, right? 5 years preparation, 5 years implementation, 5 years of changing. So that's the pattern that we see. But in the first 10 years after 79, or 15 years, there's an aid contraction. So when Deng Xiaoping said, well, we're still a developing country, we're receiving aid, we're not in the position to provide aid, the China medical team has dropped. The number has dropped, the frequency has dropped. And it was also during the time that China's hospital system are going through the changes of marketization, privatization, or marketization. So the hospital has to support themselves. And doctors would not want to go abroad to work this for free, right? So that's the period that we do see the aid contraction. However, that changed after the mid-90s when China's economy has gradually changed into a export-oriented economy. And the idea of go global, and especially with the FOCAC, that's the Forum of China-Africa Cooperation, started in year 2000. This changed the aim, the goals, and the way that global health aid is implemented. In the next few slides, I'll show you the increasing of number of aid program to Africa during this time. And here we see that if we see the smaller items, we see these are the types of health aid activities. And we see that China really never dropped the original form, which is the China medical team and the medical training. But every time in this period that they change, they added more. So in early stage, they added bundled projects, they added the medical donations. And then during the BRI time, which is the peak of China's export-oriented economy, we see a lot more activities that relates to humanitarian aid, relate to supporting the regional lab and the African Union headquarters. And so you see there's a changing of the scale of the aid. And I would say the third in the current stage we are in is the third phase of the global health aid, and that's flagged by the global development initiative that President Xi Jinping announced at UN in 2021. The idea definitely not started at that time. In 2018, we have seen this, the setup of CITIGA, which is the China International Development Cooperation Cooperative Agency that trying to separate the foreign aid from the BRI investment. All right, so here we talk about that with different goals of global health, we see that these activities and implementation has been putting into different agencies. Early in the Maoist time, it was the Ministry of Foreign Affairs that focusing on health diplomacy. And during the short period, well, still 15 years of aid contraction, when the foreign aid is pouring into China, the outward-looking foreign aid was under the Ministry of Health. And then start from 2003, that the new MOVCOM, which is the Ministry for Trade and Economic Development, that becomes the main agency that implementing the foreign aid. It's not just one agency. There's a network of 33 agencies that participating, but it's chaired by MOVCOM. And the MFA still have a say, especially the veto power during this time. If a country's Taiwan policy is not aligned with China's policy, then they can veto the aid. And of course, the Ministry of Finance is keeping an eye on the budget and spending of these projects. But that changed in 2018 when CITIGA was set up. Right, so that's the governance and history of China's aid, but I will quickly flip through a few data slides. So this is from a data looking at after year 2000. So this is in our second phase of the global health when China is focusing on the economic development. As you can see that all projects, these are public funded, at least some Chinese government funding in it. In Africa, grow about five-fold between 2000 to 2018. Similarly to the red bar are for the health project, also grew about five-fold during this time. And of course, during COVID-19, the health project overshadowed all the other projects in number. One limitation is that we can't do much on the dollar amount, the funding for each project. Health project actually are much smaller compared to many other infrastructure projects. And here we look at the type of funding for the health project, over 2,000 health project. And here, I'm sorry about the small fonts here. Most of the 67% of these projects is funded by grants. And about 30% are medical teams or technical assistants, so we don't have a dollar amount for that. Only about 58 projects are based on loans, and that's about 3% of the projects here. And among the 58 loan-funded projects, interestingly, more than half were not concessional loans. It's a market rate loans here. So that's the situation. And we talked about that China never really stopped any form of aid once it took root. So here we see that from the very early, the flagship of China Medical Team to the more recent developments such as finance the donor countries, donor organizations, setting up the short mission programs, financing the national health projects. And in the midst of that, there's medical construction, the donation of medical products. These are all in this under this umbrella of global health aid activities, and they all pretty much grown over time, at least until 2021. And we often say that China's aid is different from the Western countries' aid because it's targeting infrastructure, it's targeting basic health system, providing the primary care or specialist to the health system, and not focusing on disease itself. What we found is it's a mixed. China did focus on malaria response in many African countries, especially I think after 2006 FOCAC, when malaria was anti-malaria projects were officially putting on the agenda. So we see a surge of anti-malaria medicine and clinics support around 2010, but then it also dropped. I think partly due to some of the contamination, some of the fraudulent medicines and issues with those clinics. But then, of course, with Ebola and COVID-19, those are the two times when recent pandemics that China put in quite a lot of support, large medical teams and medical teams. So when we look at the distribution, we see that before or after BRI, there's really not a lot of changes in the support levels by country, other than, during 2014, there's more support to the West Africa. But during the COVID 2020 to 2021, which is the last chart, then you see that the aid expanding more to the north and south in Africa. Now, from the two country case studies, we chose Sierra Leone and Kenya just because they are very different countries in different economic stages, development stages, and China's approach to them are also very different. China's global health aid to Sierra Leone follows a very traditional China aid model. That is with a friendship hospital, with a continuous China medical team. There are actually 25 teams in 51 years, and they provide all three types of medical training, that including the medical degrees and local training, and as well as a short-term China trainings in China. They recently, especially after COVID, after the Ebola, China did help the country to build its own, the first and only biosecurity level 3 lab. And China also built a tropical disease surveillance lab there. They also start to work with the UNFPA in the country. That's also relatively new. With Kenya, on the other hand, it's a more of a newer model for China under BRI to the way that they work to support a country health system. With Kenya, especially, it's named as a springboard to the Africa on the technology. We see more of hospital expansions. Most of these hospitals are under with the name of the presidents. We also see a lot of advanced equipment sent to the country, and some of the Kenya projects are based on the concession loans, and there were actually some political cases, corruption cases that surrounding these aid programs. So I just want to see these are very different approach. And I'm going to talk about the advantage and the disadvantage of China's health aid there. First of all, China's aid is visible. In Sierra Leone, we see the hospital, we see the medical team, we see the training system are one of the many, China's one of the many countries that providing medical training. But back in the 80s, Russia and China were the only ones that providing these trainings. And we also see the labs and the malaria research of China's teams were there. And in Kenya, we see a lot of the roads, railroads, highways, government buildings. And we also see technology-related items such as support to telemedicine and digital medicine. Now, the weakness, I put a Chinese term here. It means we see the products, but we don't see the people. So that highlights some of what we heard on the ground. One is the communication barriers. So many of the medical team often cannot communicate with the locals in their language, in English. And they rarely attend international donors coordination meetings. And some even question, when they do research there, what they are working on. They never disclose that to the country, but later on they see the publications. So the lack of transparency caused some of the suspicions of their motives. And some of these transaction action usually is Chinese government to the local government to the country government, but the local government or the local stakeholders really don't understand how these aid decisions were made and how much price the country paid and how it's distributed in the country, right? And often, because of the lack of communication, there's a mismatch of the timing and also the needs for the locals. So in Sierra Leone, one staff at the medical board would say that suddenly they see all these Chinese vaccines showed up in the embassy and then to their door, but there's no discussion about how to deliver these vaccines to the communities and when this can happen and so on. So these practice may cause some of the waste. And in the field, we did see a lot of broken equipment, that hospitals lack of maintenance and lack of replacement parts for issues that cause some of the sustainable issues. Now, the three discussion points I want to bring up. One is we see a lot of weaknesses here, and on the ground, grassroots level, we did see that this may hurt China's reputation and its soft power. But is the GDI, which very much focus on the soft power of China, and the setup of CITIGA in 2018, a signal that China's foreign aid is going to change? So when we say there's no data on impact, no official data from Chinese government, CITIGA may change that. So since its inauguration in 2018 to this day, I listed some of the CITIGA's what they have done. One is about their system and mechanism of their foreign aid, and second part is really about building the documents, the regulations, the foreign aid governance law, foreign aid qualification law, and they even have a aid evaluation system, even though now we still cannot access the data publicly of these, but we know they're building these systems, and hopefully that will improve the transparency. The last thing that they did recently, is looking at different funding mechanisms. So they are doing the fundraising for these foreign aids. So that's the first notice. So I think we have to talk a little bit about the Global Development Initiative, what it is, right? It was announced in September 2021. So some of the keywords are, I put in this word cloud. It does have 8 core areas ranging from the poverty reduction to infrastructure to public health and climate and industrialization. So this is the idea that contrasts to BRI. The BRI is really focusing on countries, on bilateral collaboration or win-win strategy for China and the country. It's regional and it's Sino-centric economic operation. The GDI, at least it's aimed to be topic focus rather than country focus. It's technically open to all developing countries and focusing on these global challenges. So what we see from some of the documents in China that published by the CAID, there's 3 paradigm changes that can cause by the GDI. One is China's foreign policy relations will switch from the bilateral regional focus to more on the global top challenges and topics. And secondly, it really wants to build up its soft power to change its international environment because they talk about a not optimal environment for China's development. And lastly, to change from economic focus to more on the global governance. So these are the Chinese scholars' analysis. So the second discussion point is, okay, so if China wants to build soft power, what does it mean to global health? So I'm not going to go into this detailed analysis in the report that looking at each of these 8 activities, what are the risks for soft power? What are the advantages for soft power? But I would like to highlight some of the points that brought up by Professor Joseph Nye, of course, who brought up this idea of soft power, is that soft power in terms of the country's global influence is often not about the government initiatives. It's about the people who implement them, right? So Professor Nye used a very interesting, I thought, analogy. He says the dog needs to wag the tail. So basically, the tail is the foreign policy, foreign relationship, foreign policy, but it's coming from the dog, from its domestic policies. So the behaviors of the people implement these projects really reflecting the governance system within the donor country. So self-interest would be deadly to soft power building, and patience and sustainability would really help in that image. And lastly, I would say, maybe because I'm a global health, I chair a department of global health to train the next generation of global health leaders and implementers and workforce. I do see that China is lag behind from other Western countries, that as the ODA increase in the early year 2000, we see that in the US, there's many universities pop up with these training system for workforce that can go into evaluate the programs, can make a good design of these programs, can engage the civil society and non-government organizations. And China just started on this. Earlier we talked with Professor Huang about Tsinghua's regional study, and they require faculty and students to be in the developing country, but that's very, very rare still in China. So I want to give a voice to these new initiatives in China. And I think that's another signal that China is changing its approach to global health. And I did provided a few policy recommendations, especially responding to U.S. American First Global Health Strategy that really focusing on bilateral agreements and benefits to the U.S. commercial interest. I think what we have seen on China, lots of the problems for soft power really coming from the trade and economic focus of the global health program. So just want to bring that up as a voice to advise the government. And for African recipient countries, we've talked about there's a lot of reflection there. And I wonder that now when China's more focusing on soft power and China's more interested in working with multilateral organizations and regional organizations, whether that would be a good lever for the country to reinforce the transparency and accountability of these healthcare projects. And of course, we are all thinking about, are we looking at aid or are we looking at the capacity? And on that, I think China has both advantage and disadvantage in providing those. So that's my presentation. Thank you. So at the end, I would say, aid or investment and what is at stake. I would say there's aid, there's some investment, and at stake is the soft power. And now I want to end it with aid or investment and what's next. Thank you. Sorry, I'm really over time.
Yeah, no problem. Would love to hear from Professor Huang.
Okay. Well, thank you. Thank you, Jennifer, for giving such a so what's the thanks to our moderator? Well, thanks to Jennifer for giving such a wonderful presentation, and would like to thank Georgetown for inviting me to discussing this fascinating report. And I'd like to congratulate Jennifer and her team for this really timely and much needed piece of work. It's clearly they have done a commendable job in bridging historic analysis, quantitative data, and on-the-ground perspectives from Africa. I think one standout strength is how it seeks to demystify, China's, opaque, health aid system. We know that it doesn't routinely disclose aid stats, but report smartly navigates that, by drawing on sources like aid data and field studies. So it's not just numbers, the visuals, like the figures on project trends for malaria, Ebola, and COVID makes the evolution tangible. I think the report also has significant policy implications. Jennifer mentioned this. The report mentions the U.S. America First Global Health Strategy, introduced September 2025. It positions global health assistance as a strategic tool to counter China's growing influence. But when I went to the report, I mean, not Jennifer's report, the global health strategy, went to that strategy. It offers no real strategy on how to compete with China in the field. The strategy recognizes Africa's strategic importance, but it says almost nothing about what China is actually doing in global health in Africa, except mentioning debt aid and its reliance on state actors, not to mention like China's global health activities elsewhere. So one wonders, is this strategy just a disingenuous or just a lack of knowledge, right? So if the latter, policymakers really needs to read this report because it provides the comprehensive assessment that the U.S. policymakers needs to navigate this evolving landscape and make informed strategic choices about the U.S. future role in global health diplomacy. So, and also I think against the backdrop of the U.S. retreat from global health, right, the report sheds critical light on the prospect of China, filling the void left by the U.S. by detailing China's expanding role from medical teams to infrastructure and pandemic response. It highlights how Beijing might step in to provide alternatives, especially through multilateral channels under the Global Development Initiatives. I also found the discussion of phase three. I mean, the phase under the Global Development Initiative very insightful because this emphasis on soft power and global governance. And that insightful analysis shows how health aid has been retooled from, anti-imperialist bonding, or serving, as a tool for economic development to a tool for projecting soft power. For instance, the finding that GDI marks a pivot toward providing public goods like multilateral frameworks is significant, especially as it contrasts with BRI's Sino-centric focus, as Jennifer presented just a couple of minutes ago. In a world where the U.S. is framing China as a health competitor in its own strategy, this evolution helps explain why China might be dialing back pure commercialism to build longer-term influence. The discussion also, I think, has important implications for the future of multilateralism in global health, right? In the context of the U.S. withdrawal from WHO, in the global retreat from multilateral health aid, China's focus on regional, multilateral platforms could be a viable alternative to the post-war multilateral order. I also like the report finding empirical evidence supporting that China's health projects are mostly small and beautiful. That's in contrast of the Trump's big and beautiful project. The small and beautiful projects, this is the important findings, because if you look at those projects, right, they have large numbers, 2,000, right, but still small, right, in terms, percentage of total foreign aid and the size of those health projects. I think this nuance counters, oversimplified narrative, of China dominance in the region. Also, some of the findings help shed light on China's interest in global health when investing in R&D, right? So we saw that despite this interest or investment in global health-related R&D research and development, the Global Health Drug Discovery Institute at Tsinghua and the Global Health Innovation Institute launched just last month in Shanghai, the report suggests that the research and development is not a priority in China's global health aid, especially if you consider what the report talk about how malaria aid activities in targeted countries were siloed from Chinese public health researchers' pursuit of malaria research. It also implies that China's aid implementation and its public health research were not integrated, remains fragmented, revealing sort of a disconnect that could inform future policy. I think a particular significant contribution of the report is the integration of African voices through case studies in Sierra Leone and Kenya, right? Because too often, as Jennifer pointed out, these discussions are Sino or US-centric, without considering the perspectives and interests of recipient countries, the real stakeholders there, right? But here, the Jennifer and her team sort of center the stakeholders' mixed perceptions, the praise, for infrastructure like hospitals, labs, and training programs, but critiques of debt traps, lack of transparency, and sustainability issues. Just to think, this vaccine waste from poor coordination or equipment breaking, without parts. The report's takeaway, that China's trade-focused mentality erodes trust. I think it's spot on and underexplored in prior literature. It also highlights the systematic pitfalls like subordinating health outcomes to commerce, which undermines China's soft power. And the policy recommendations are pragmatic, by urging the U.S. to avoid, over-commercializing its own aid, preserve multidisciplinary workforce development, and for African countries, to leverage regional platforms like the AU for better negotiations. I think this balanced view, by acknowledging benefits while criticizing flaws, makes the report a valuable tool for policymakers without descending into alarmism. For the time's sake, I have all the parts of the I think is also very interesting, but just I think this is a very insightful, informative report. And of course, no report is perfect. There are areas where this one could be strengthened or improved. For example, when discussing China's vaccine diplomacy in Africa, the report provided very interesting information on the vaccine delivery problems, lack of implementation level consultation. I think it might be helpful to include information like the overall vaccine diplomacy in the region, percentage of donations, voters, this for sale, and how the local people viewed, like the efficacy of the Chinese vaccines. And also, I think, even though the report's regional focus is Africa, it would be helpful to compare China's health aid to Africa and that to other regions like Southeast Asia and Latin America. Right? That would reveal the status of the status of Africa in China's health aid or the global health strategy, if they have any. Because the distribution of vaccine may suggest Africa, actually not a priority of health aid during the COVID-19 pandemic. It would also help us understand China's shifting priorities and priority setting processes in development assistance for health. And finally, I think on the soft power angle, I think the report smartly analyzes how China's approach risk eroding trust through the lack of transparency and commercialism, but it could interrogate the U.S. parallels more critically, because we know the American First strategy is mentioned as recognizing China as a competitor. But does the U.S. avoid similar pitfalls? I think maybe a comparative table, like building a table for one's soft power assets and risks, could contrast the U.S. and Chinese models, highlighting where the U.S. excels, like transparency, and where it might falter, like tying aid to a strategic interests. This could make the lessons for the U.S. even more actionable. And finally, given the report's 2025 data, it could address emerging trends like climate health interactions or AI in health aid. How might GDI incorporate those, and what does it mean for Africa? So now to quickly wrap up this discussion, I'd love to pose just several questions to Jennifer to clarify or expand on her and her team's work. This is just meant to spark discussion, not as a criticism. The big question is, do you see China filling the void left by the U.S. in Africa? And do you see any signs suggesting any significant increase of China's health aid in the aftermath of the U.S. withdrawal or retreat from global health? And secondly, about the role of CITCA, right, the supposed lead agency for China's health aid. What's their role in drafting new aid policies? Did it lead to tangible changes in project transparency or local involvement? To what extent is it becoming an important actor in China's health aid? What's the relationship with MOFCOM? Right? How powerful actually it is in development assistance for health-related decision-making and implementation? I have a third question, but I think, again, for time's sake, I will skip that. But to conclude, this report is a solid, informative, insightful contribution that fills a critical knowledge gap on China's health diplomacy in Africa. It reminds us that global health isn't just about vaccines, hospitals. It's a battleground for influence where soft power hinges on trust, transparency, and true partnership. So by centering African perspectives and evolving motivations. I think Jennifer and her team provides lessons not just for the US and China, but for all donors. So congratulations again for the publishing of such an important and timely report. I'll stop there.
Well, thank you very much, Professor Huang. I think thank you for your kind words. I always see you as a mentor in terms of looking at the political aspects of global health, and I'm really happy to hear that you agree some of the views from the report. And you have already highlighted several things I wanted to do. The next one is really looking at how U.S. Global health, when we're looking at the soft power assets, risks, and the risks and advantages, how U.S. has been doing. What I've seen, this is again 20 years ago in China, when China was an aid recipient country. I see what U.S. Global health work has done, not only bringing the technology, but and the treatment aid, but also we see the American doctors will go to prisons in Yunnan to teach the prison doctors how to treat HIV. We see them building workshops in rural village in Anhui to help the village to reduce the stigma of HIV and to help the patients. That's why I see that lots of the soft power is bringing by the people who are conducting this aid. Whereas in China, many of the risks comes from the miscommunication and the lack of presence of the human factor there. But that's certainly something I really want to continue to pursue. And I really liked your comments on, for this one, we look at Africa. And China-Africa has a very unique platform through BRI, through FOCAC. But you're right, there's a report by Fudan University researchers, Huang Jiayan, her team actually looking at the BRI projects and its health aid. And they found that since 2013, that the BRI projects, China's health aid actually shifted from the focus in Africa towards more to the Southeast Asia and Latin America. And that's something certainly will be a field that needs more investigation. And to your two questions, the first one, will China filling the void? That is a question that every day we're wrestling with. And from my observation and research in China, I see that that China do not think they have the ability to filling the void. And that's why CITIGA highlighted the global health finance, who will finance the global health void that we see now. They're talking about debts to health, the D2H transformation. That when China cannot get, will convert some of its loans as debts, convert that into the health aid of projects, or at least funding for global fund, for example. This is following what Germany has done with the global fund. So they're talking about different finance mechanisms. But I don't think this is when China will say we're still a developing country. So that's one. So funding is one that China is short of given its own economic status now. The other part I don't think China can fill the void is the human capacity. So even with the existing projects, we see there's lack of presence of Chinese professionals in the field to help implementation, to help evaluation. So those is the gap we see between the Chinese aid versus the Western countries' aid. Lots of the funding, the project now is really about procuring the products from China and send it to the custom of the country and delivered by the Chinese embassy, where their trade representative will hand over these products. So there's really no representative of public health or global health in Chinese embassies in these countries. And not the people who can coordinate the last mile of these deliveries. So on that sense, China right now do not have the human capacity to fill in the void. I think some of the new projects that I've seen in Africa through the UN agency local offices might be the short-term solution. If China can fund UNICEF or UNFPA and support some of these local offices that has the capacity to implement these projects, then that would be a success story. However, I will warn that if China given the funding to fund the local office, that will help China's these projects, but it may not help so much on China's soft power because the lack of the presence of Chinese. So that's for the first one. Is the void is huge. It's hard to fill in with the fund from the funding and the human capacity perspective. And your second question is about what is CIDCA doing now and its relationship with MOVCOM. So I think Sun Yun, another researcher from Stimson Center, talked about the funding for the annual funding for CIDCA is much, much smaller than the MOVCOM. And MOVCOM also has advantage that they, other than the MFA, the Foreign Affairs, they can have a representative for trade in each of these embassy centers. And MOVCOM have tremendous more political power in China compared to public health or even the education, Ministry of Education. So MOVCOM still have the majority of the funding for all of these foreign aid, and they're still the primary aid designer and implementer for these programs. CIDCA, what I see is also not insignificant. In over the years, we see that they began to draft these regulations, and they have built let me see the term for that, the menu for foreign aid project database. That I think that's under the CIDCA's Global Development Promotion Center. So even on the website, we can see the database for the projects, the database for the finance, the technical, the framework is there, but I cannot get access to the database. So I see the CIDCA's role is more of building the framework for policy changes. And what I heard is that the foreign aid will need to be approved by CIDCA, but still implemented by MOVCOM because of the the capacity issue. So that's what we see, and we will monitor and see whether it's truly as the GDI says that China will move away from the narrow economic focus to more of a global governance. Thank you. And I see there's a question in the Q&A and asking for when the report will be published. So as I said, the report has been approved by the quality assurance by RAND, but the printing in the publication process is still may take a couple of weeks. But if you're interested, I can send me an email, and I can send you a pre-production version of the reports. Thanks. All right. Any other question? Professor Jilly,
Oh,
welcome to Georgetown.
oh,
And I
yeah.
know we
Oh,
work together about the technology
yeah.
in China's exports in Africa, and you have been really experts on. So I think one of the items that Yan has brought up is how AI and how climate are used are implemented by China's aid. Maybe you can answer that question better than I do.
Yeah, but it's definitely not my panel. But I was quite curious to kind of hear a bit more about uh what you think about China's slowing down economically speaking, and how that directly impacts its general prerogatives around leveraging or retooling health aid as kind of soft power. I ask this obviously from my own kind of field, where what we've noticed is that there's also a general decline in trying to leverage ICT investments and technical assistance, in part simply because of trepidations over the slowing down of their own kind of domestic affairs.
Yes, yes, thank you for that's a great question. That I think, as Yan also highlighted, that we talked about after GDI, after post-pandemic, we see that the ambition of China's Health Silk Road certainly has dropped into more of a small and beautiful. So I cannot present the total dollar amount of the health project compared to other projects in foreign aid, because there are lots of missing data. It's hard to estimate the cost of a China medical team, for example, or the training. It's hard to convert that into a dollar amount. But for the ones that we did see that the amount of cost for the health project is less than 1% of the total cost of the China's foreign aid. So I think, as you said, when China's economic output is not as well as, say, 10 years ago,
Mm,
but it's still a increase. I always want to remind people that, yeah, now it's a 4%, maybe 3%,
mm,
but compared to certainly lower than 10 or 20, 15% in the past, but
mm,
still it's an increase in the economic output. And its export market is still doing quite well, even though the domestic consumption it's having troubles, right?
mm,
So I think in this sense, there will be more interest
mm,
in health oriented projects. So
mm,
I can see there might be a more selective, large infrastructure building projects that
mm,
cost a lot and take on a lot of loan, a lot of debts for the recipient country. That's not a good practice either. But I think the health project, especially focusing on the training. So the
mm,
training is not just the medical training, but also managerial training, how to deal with finance, how to deal with the project implementation operations in the field. And in terms of technical transfer, that's your area, but I see that they do bring local technicians to Shenzhen to to train for maintenance of the equipment. And they have just starting to build some more factories in industry zones in Africa. But as Yanzhong said, it's not a lot in Africa. And as you can see from my case study, that they do put in more technology products to Kenya compared to Sierra Leone, just based on that country's current ability.
I would like to really call on Professor Park. I know that she also has a question to ask the panel.
Great.
Thank you both so much for your presentation and your comments, Yanzhong. I was thinking about kind of China's other activities in Africa, especially in terms of the agricultural demonstration projects. And some of the critiques that I've read about those, the few studies that are out there, often indicate that even though it starts off as a kind of Chinese state kind of foreign assistance activity, that oftentimes they seem to be vehicles for Chinese private sector to eventually sell seeds or kind of push their own equipment and technology. And ultimately, because of a kind of incapacity to kind of pay, for the final kind of African users to pay for those things, then the agricultural technology demonstration projects end up just kind of fizzling away. And I was wondering, in terms of some of the Chinese medical activities, if we're seeing similar issues where it's kind of the foreign assistance kind of that that is meant to pave the way for Chinese private sector engagement, or as you were alluding to just now, if there's a kind of issue around skills and technology transfer, particularly in terms of management, administration, kind of repair of some of the more sophisticated equipment, because some of the reports that I've read have indicated that, all the instructions and the instruction manuals are all left in Chinese. So then, nobody is able to fix them. So I was wondering if we're seeing similar issues in the medical and health sector.
Yes, and that's a very good observation from you. I'm really glad to hear your observation with these demonstration centers in agriculture. I think it's very similar. And given that most of the foreign aid is really implemented by thank you, Professor Huang, implemented by MOVCOM. And MOVCOM's model is to contract with China's SOEs, state-owned enterprise. So you see that when there's a hospital set up, of course, in recent years, there's also a loan from the China's Development Bank, and then to fund the state enterprise large companies to build hospitals and then give the key to the local government without following up. And some of the equipment, just as you said, is really the platform being used as a platform for demonstrate China's technology advance, in addition to the support. So I think the difference maybe for the health programs, education and the technical transfer seems still to be in the core of its interest. So they still want to do that. But I also think, given that the implementation still through MOVCOM, it will be very difficult to change that model of promoting trade in economic model, because that's what MOVCOM's main mission is, right? So unless China can or CITICA can bring in more public health experts and the perspectives. Before that happens, it would be very difficult to change that technology demonstration model. Yeah.
I wonder if Professor Huang has any comments on my question.
Oh, I was when you talk about what is the actually Jennifer also in the report talk about the difficulty of recognizing the Chinese characters. I was just thinking, right, to bring the issue of that like AI, right? I think AI telemedicine can solve many of those issues, right? And now you need to scan, right? Those the ultrasound report, right? Even though it's written in Chinese, you could actually sort of automatically translate it into a local language. So I do believe, there's maybe there's a chance this telemedicine, that AI China is giving a growing attention to this could, has the promise, to us, allow African countries to leapfrog, right, significantly improve the health standards on the continent.
Very interesting observation. I know we're almost at time. I don't know if Jennifer or Professor Huang has any final kind of comment that you wanted to make.
I see there's another question from the chat. That's from Rafiq Dasani. So thank you, Rafiq. The question is whether, like what the Rockefeller Foundation calls for, the local government to increase their capacity to collaborate to address some of the corruption and building the system for more aid efficiency and what China can do there. I think that's a great question. I think China right now, the most of the aid mode is really about delivery stuff there. So I don't think they really focus on helping the country on regulations or governance system. At least that's what I've seen. I haven't seen that. But I think given their ambition of global governance, they're more likely to support the country by funding the multilateral organizations such as UN agencies or WHO or AU, African Union, to strengthen the regional capacity and then getting to countries' regulation. So I see that might be the route that will move forward. Thank you. Again,
Thank you,
I just
Jennifer.
want to thank Yon and Bulinani and Yanzhong for this great conversation, and I'm looking forward for more opportunities to work with everyone.
Yeah, great. Well, yeah, definitely. Thank you so much for this amazing panel, and thank you again to ACI for organizing the event, and especially for Yoon's amazing work with all of this.
Thank you, everyone, for joining us. We have 2 more in-person events. So if you're anywhere in the DC area, please join us in November. We have, as I said, Alice Schenzingre from France, who's going to be speaking on economic engagement and continued kind of inequalities between China and its African partners. And then we're also going to have a film screening of a new film by Melissa Lefkowitz. Hopefully all of you are remaining on the webinar are on our mailing list. We'll be sending around more information about those 2 events. But again, thank you so much again to all of our panelists, Bulalani, Professor Huang, and Professor Bui, for sharing this really, really important report. I think it's a huge contribution to the field. As soon as it becomes publicly available, please continue to check the RAND website. You should be able to access it for free. We will have a recording of this event on our website, as well as the US-China Dialogue website in the coming weeks. So keep an eye on that to to share with your colleagues. And again, thank you so much for joining us this morning.